So this is a really interesting study that was published in the Lancet a couple days ago, something like that, about the benefits of switching to a single payer Medicare for all universal healthcare type system in the United States. This was in a peer-reviewed journal article, so it had to, go through the standard academic rigors in order to get published, so we can feel pretty safe that these numbers are up to snuff, if you will. So this is the summary from the report. Although health expenditure per capita is higher in the USA than any other country, more than 37 million Americans do not have health insurance, and 41 million more have inadequate access to care. So what does that combine? 78 million, a good, almost a quarter of the population either doesn't have insurance or is underinsured. And if we go back to this first sentence here, the US spends more on healthcare costs than any country in the world, yet we have 78 million people that are either underinsured or have no insurance, but we pay more. Do you see? And what's the only difference between the US and all of these other countries? So we have a for-profit healthcare system. That's where all that money is going to. It's not to insure people, to give people a higher quality, a better quality of care. It's to make sure that these CEOs and boards of directors and these health insurance companies are able to, make millions of dollars while people are still dying because they don't have health care, because they don't have enough of it, and it's sick and disgusting. By contrast, a universal system such as that proposed in the Medicare for All Act has the potential to transform the availability and efficiency of American healthcare services. Taking into account both the cost of coverage expansion and the savings that would be achieved through the Medicare for All Act, we calculate that a single payer, highlight this because it's really important, we calculate that a single payer universal healthcare system is likely to lead to a 13% savings in national healthcare expenditures, equivalent to more than $450 billion annually, based on the cost of the US dollar in 2017. So more than likely, the savings could potentially even be more in 2020 because healthcare costs have continued to skyrocket in the United States. So equivalent to more than $450 billion annually we would be saving by switching to a Medicare for All system. So all of these people, obviously the Republicans are totally against it, but even centrist Democrats, a lot of them running for president, it's going to cost so much money. How are you going to pay for it? People like Joe Biden, Pete Buttigieg, and it's just super, super disgusting and disingenuous because this is not the only study that has shown the substantial amount of savings that are created by adopting a Medicare for All universal single payer system, which it just makes sense. The bureaucracy, the red tape, calling up your insurance company, am I covered for this? Let me check. I got to get back to you to see if it's in plan, if you met your deductible, a co-payment. All of that stupid bureaucratic BS goes away. You actually get real choice. The U.S. healthcare system now, there is no choice. You're dictated by the insurance plan that you have. Am I in network? Am I out of network with this doctor, with that provider? With Medicare for All, you get to pick any doctor you want to go to. That's giving you real choice. I don't want choice between what insurance company I get to pick that's going to rip me off in some way or deny my care or not give me enough care. I want to be able to pick what doctor I get to go to. I don't want any type of profit motive in the healthcare system. It's just disgusting, and we need to catch up with the rest of the developed world in this area. The entire system could be funded with less financial outlay than is incurred by employers and households paying for healthcare premiums combined with existing government allocations. The shift to single-payer healthcare would provide the greatest relief to low-income households. Furthermore, we estimate that ensuring healthcare access for all Americans would save more than 68,000 lives and 1.73 million life years each year compared with the status quo. So it it makes sense on every freaking level to adopt a universal single payer healthcare system in the United States. It saves close to 70,000 lives each year. That is like a Super Bowl full of stadium, full of people that wouldn't be dying because they don't have health care, because they don't have access to enough of it, or because they can't afford it. It also saves hundreds of billions of dollars a year. This study said equivalent to more than $450 billion a year, or 13% reduction in healthcare costs in the United States by switching to it. It makes sense on every level. And again, the only candidate who is fighting to make sure this is a reality, so people aren't dying, so people aren't going bankrupt because of medical debt, is Bernie Sanders. And it saves money. So again, any candidate, whether it's a Democrat or Republican, or they're elected or whatnot, or just any pundit on TV or friends or family members, call them out when they say that switching to a Medicare for all system would cost people in the US more money. It saves us huge, massive amounts of money, and it is the right thing to do on an ethical and moral level. Bernie Sanders is the only candidate who understands this. This issue is super, super important. That's why we got to do everything we can to make sure Bernie Sanders is the nominee. And once he is, everything, all hands on deck, so he beats Donald Trump, which isn't going to be an easy task, I don't think. So those are my thoughts. Leave yours in the comment sections down below. Peace, not me, us.